Hello everybody, welcome to VMC. I'm Dr. M. You may have looked at this video and gone, ooh, it's a little longer than the others. That's because I've decided to make a compilation of all of the nutrition videos. This is one of my most popular video series, and there are a lot of new subscribers to VMC in the time since I put these videos onto YouTube, so I thought it would be a good idea to make a compilation of them for all of the new people and for those who wanted a bit of a refresher. Thank you so much for joining me in 2024. I wish you all the best for the holidays and into the new year, and we will continue posting a video most Fridays. We'll see you next week. Hello, welcome to VMC. I'm Dr. M. Today we're going to start covering the topic of nutrition for our cats and dogs. Join me, you'll learn something. So the first thing to know is that the term nutritionist is not at all a protected one. What that means is that any person can call themselves a nutritionist or a feline nutritionist or a canine nutritionist or a pet nutritionist. Any of those titles mean absolutely nothing. The person who is calling themselves this may have zero training, they might have outdated training, they might have non-research based training. There's no way to tell. And so if anybody is calling themselves any of those things, completely disregard whatever information they are sharing. The only acceptable options to look for when looking for pet nutrition titles are either a board-certified veterinary nutritionist or a veterinary technician who has specialized in nutrition. Both of these programs involve years and years of studying at a university level. They also require continuing education every year. They also require the individual to be involved in nutrition research, and there is a residency program that the person has to complete, and at the end of that residency there is a notoriously difficult board exam that has to be passed in order to call yourself a veterinary nutritionist or a veterinary technician who's specialized in nutrition. The other key component about these actually trustworthy sources of pet nutrition information is that they will form a team with your veterinarian. So your GP, vet clinic, will be looped in as part of the team. Having that clinical component is crucial when discussing nutrition, as there are so many different factors that will affect the nutrition choices that are made for an individual pet. Their age, their lifestyle, their body condition score, their medical history, all of those things matter and will influence nutrition choices. It should also be noted that a GP veterinarian like myself, as well as the accredited specialists, we will all have a very in-depth background that covers how to read research papers, what sort of weight to put on their findings, and even reading these studies is often a bit challenging and can be a bit of a slog to get through them. And so you need people who have years and years of training, who know how to parse that information and then, most importantly, apply it to the real world. It's also very important to remember that we look for consensus statements. If there is, 90% of a group of experts are saying this is what we should be doing, and then there's the lone voice on the other side saying no, that's wrong, the chance of this lone voice being correct is essentially zero. And so these lone voices need to be ignored, and we need to be looking at consensus statements from experts when we are guiding decisions on what food is best to feed our pets. First, it's very important that we remember that the ingredient list has nothing to do with food quality. And this is really important to know because so many people use the ingredient list as their main way of deciding if they're going to purchase a food or not. And some unreputable food companies know this, and so they will manipulate the ingredient list in ways to make things sound better. What we actually care about is the bioavailability of the micronutrients that are in the diet. So think about this for a minute. Can your pet actually use the vitamins, minerals, proteins, fiber, and everything that's in these diets to the degree that they need to be able to. The ingredient lists are ranked by weight. And so food companies will put in, this is a very common marketing scam, they'll say it's meat first, and they'll have chicken listed first in the ingredient list. But what they didn't tell you is that they weighed the chicken while it still had all of its water weight. Then once it's going through the process of being formulated as kibble or canned food, a lot of that moisture is removed, and the actual protein that you need from that chicken that's remaining is far, far, far less than what they are leading you to believe if you look at the ingredient list. And so a food that has, say, chicken meal in it, but if that's in there, those diets are actually more likely to have a better quality protein source because the meal already has the water weight taken out of that ingredient before it's weighed. The other thing that ingredient lists don't tell you anything about is the quality of each individual ingredient. Are these ingredients top quality? Are they incredibly poor quality and therefore less nutritious? Who knows? The ingredient list sure does not tell you. The ingredient list also does not tell you the proportion of these ingredients. Like I said, it just lists them in order of weight. And it also tells you nothing about how well your pet can use that ingredient. If the ingredient is being ingested, but all of it's just leaving the pet in their feces, then it hasn't helped your pet at all. And so an ingredient list is useless when you are attempting to assess the quality of a pet food. Another thing that people will use are websites. There's a few notorious ones that claim to assess the quality of the food and rank them. Don't use any of these websites, they're useless. The reason that actual experts don't put forth these websites is because the foods change all the time and it would be impossible to keep it up to date. If you actually look into who's running these websites, one of the most popular ones is actually run by a human dentist who has zero education in pet nutrition and is putting out horrifically wrong information. Don't use these things at all. The people running them are not experts. I want to remind you to subscribe if you haven't already, and don't ever hesitate to comment with future video topic ideas that you might have for me. I'd love to hear from you. All right, let's go on to the standards that you should expect from your pet food manufacturer. So essentially, you are trying to assess the quality and the nutritional expertise of this company. Now, the World Small Animal Veterinary Association, or WSAVA, has a toolkit to help people with deciding which food they should be feeding to their pet. And their recommendations are research-based and are excellent, and these are the standards that I use when picking food for my own pets as well as making recommendations for my patients. Their first standard is that the manufacturer must include at least one full-time veterinary nutritionist. So there are a lot of companies that will hire a veterinary nutritionist, but then they will have an entirely different and unqualified person actually formulating the food. That's why standard number 2 states that it's very important the person who actually formulates the diets needs to be a board certified veterinary nutritionist, and often these people will also have a PhD in animal nutrition. The third standard that WSAVA has is that the manufacturer owns the plant where the food is being made. If they do not own the food manufacturing plant, their ability to control the quality of the formulas goes down dramatically, and they simply will not be able to put out an excellent product. This leads us to the fourth standard, and that is considering the quality control measures that the manufacturer has in place. These companies need to be testing the ingredients that go into the formula, and they also should be testing the end product to make sure that what they are making meets the standards that the veterinary nutritionist has made for that particular formula. So they should be testing for nutrient content to make sure there are no pathogens like Salmonella or E. coli, and to also make sure that there are no aflatoxins in their products. This also means that the manufacturer should be doing audits of all of their suppliers. There are a few companies that are not WSAVA compliant, who have multiple times blamed their suppliers for issues that have come up in the products that they've been manufacturing. It's not on the supplier. The manufacturer needs to make sure that the product they produce is meeting the standard. Next up is the AAFCO label. Now this standard is what we used to judge pet food by, and it's woefully inadequate. You can get a pet food onto the shelves of any store simply by passing AAFCO regulations. And this involves either a very short feeding trial to a small number of dogs, where essentially if they don't die, the food passes, or by running the ingredients through a computer program to make sure it should meet the requirements that are the bare minimum for keeping an animal alive. AAFCO standards alone are not near good enough when looking at pet foods. The next WSAVA standard is whether or not the company is doing any research in the area of pet nutrition. And if they are, that research should be published in peer-reviewed, reputable journals. If there are pet food companies that are not doing any research, they aren't actually invested in this, and they are not going to be producing the most current and best nutrition for our pets. And if they can't get their studies published in a reputable journal, then that means that the research was not well done and needs to be ignored. The manufacturer also needs to be able to provide a nutrient analysis for anything that you might ask them about, whether that's calcium or sodium or protein levels. And they should not be giving you a guaranteed analysis. That's essentially a minimum or maximum number, which is worthless. If they are actually testing these products in the way that they should be able to tell you exactly what is in the formula they are producing. Ideally, this would be provided in an energy basis, i.e. it's this many grams of this micronutrient per 1,000 calories, say. It should not be provided to you on an as-fed basis, because that does not account for the different energy densities from formula to formula. And so, some kibble might be 300 calories per cup, another might be 450 calories per cup. The company also needs to be able to provide to you the calories of any food on a weight basis. So how many calories per cup, or how many calories per 100 grams of this formula are in the product. If the company can't tell you that, that's a huge problem. The last standard really looks at the ethics of the company. Is the pet food manufacturer bashing other companies? Often when they do this, it's using fear-mongering or information that's false and just sounds good, but in reality isn't true. The bottom line is to make sure that you take your pet nutrition information from an actual qualified expert. And then you need to be evaluating the company that you are buying pet food from to make sure that they meet the WSAVA standards. If they do not meet these standards, do not feed that pet food to your pets. We will delve into some issues that are arising from companies that do not meet WSAVA standards in part 2 of this series. So join me for the next video. I look forward to talking with you then. Hello, welcome to VMC. I'm Dr. M. Today we are going to cover nutrition-related dilated cardiomyopathy. It's a major problem that's been popping up in the past number of years. Join me, you'll learn something. First, let's define what dilated cardiomyopathy is. DCM is when the ventricles, or the lower chambers in the heart, start to weaken and as a result are unable to contract to push blood to the body and to the lungs as well as they could before. There is a primary dilated cardiomyopathy that has a genetic predisposition, and we see this one in breeds like the Doberman, the Irish Wolfhound, and a number of others. This is more commonly an issue in larger breed dogs than in small breed dogs. And for primary DCM, we do have medications that can be used to slow down disease progression, but we cannot stop it and we cannot reverse it. So over time, because the ventricles are weakening and they are not pushing blood forward as well as they used to, this will result in more blood pooling in the ventricles, and and it will cause the ventricles to dilate. Once the disease worsens from there, you will start to get fluid accumulation in the body, and this part of the disease process we call congestive heart failure. This is more end stage DCM. There are also secondary forms of DCM. Some of these are related to toxins, and actually the most common is a side effect to a chemo medication in our dogs. We also have an infectious category, and the most common cause for DCM that's infectious is actually parvovirus. When there are puppies that are between 2 and 4 weeks of age that get parvo, they are more likely to develop DCM because of how that virus attacks their body at that age. And the third type of secondary DCM is nutrition related, and that's the one that we're going to cover in detail today. Now, no matter which type of DCM a dog or cat might have, the symptoms look very much the same. You can see fatigue, you can see breathlessness, you can see an intolerance to exercise, you can see an increased respiratory rate, you can see fluid accumulations, swelling the abdomen or the belly of the animal. You can also see pale gums. Some animals will have a decreased appetite, others might have some fainting, and sometimes the only symptom that you get is sudden death, where the animal compensates for the heart disease up until the time where they drop dead. When we're talking about diagnostics for dilated cardiomyopathy, we have two that we can lean on. First, we do have genetic screening. If there is a breed that is predisposed to developing DCM, having any dogs that are going to be used for breeding genetically screened is an absolute must. If we are suspecting that there is a DCM or another heart condition in a specific patient that's having symptoms and presenting to a vet clinic for that, the definitive way to test is with an echocardiogram. So this means that we take an ultrasound of the heart, and usually this needs to be done by a veterinary cardiologist, as they are the ones best able to read the images that they're seeing. Sometimes we will take chest x-rays to look for congestive heart failure, but also to measure the size of the heart. If it is quite enlarged, it helps to narrow down our differential list, but it isn't a specific diagnostic for DCM. Sometimes if the dog or cat has had a fainting or syncopal episode, we might check what's called a Holter monitor that traces the heart rhythm to make sure that there aren't other arrhythmias that are causing problems. Regarding treatment, we do have a number of medications that can be used. If congestive heart failure is present, then we use diuretics to help to remove that excess fluid buildup. But the mainstay is really pimobendan. This medication does help with increasing the muscle contraction ability for the heart, and so your veterinarian may recommend that to you. There are also other medications that could be part of the treatment plan. It really depends on what specific symptoms your pet has and what stage of disease they end up being in. Unless the DCM is nutrition related, the prognosis is not good. This is a progressive and irreversible disease. With nutrition-related DCM, if they are caught early enough, we have had a number of patients that will have their heart disease reversed. And this is what makes it such a different phenomenon from all the other types of DCM. A number of decades ago, we actually had a lot of cats that were presenting with heart disease, and it was at that time that researchers figured out that cats are unable to synthesize taurine in their own bodies, and so it's very important that their nutrition contains a lot more taurine than dog nutrition does. And so ever since then, the standards for cat food have changed. Starting a few years before 2018, veterinary cardiologists were seeing an increase in the trend of DCM cases that they were having come into their practice. And the other thing that was abnormal about this is that it was a number of breeds that don't usually present with DCM. So the frequency of cases and the breed of patient that it was developing in were both abnormal and started triggering alarm bells. And then in 2018, this started to officially be looked into. The FDA got involved and they started putting out some statements about having concerns about there being a nutritionally related DCM. So of course it makes sense that the first thing that researchers thought of is, oh, maybe this is also taurine related, because we have this past history of cats having an issue with getting taurine from their nutrition and how that caused DCM. And there was a thought, maybe this is the same problem with our dog food. Now dogs are obviously different than cats, and they can make their own taurine if they're given the appropriate ingredients to do so. So their body is able to synthesize some taurine on its own. Taurine levels started being tested in all of these dogs, and what we started finding was that a number of the patients that had DCM had normal taurine levels. And so now we know it may be contributing for some patients, but it's not the whole story. There are a number of unethical pet food companies that started advertising, oh, we've now supplemented taurine, so that's fixed the problem. But this is not true. Supplementation of taurine does not solve the issue for these pet foods. Before we move on to what is known about risk factors in pet nutrition, I'd like to remind you to please like this video and comment if you have any questions or if you have an idea for a future video topic. I'd love to hear from you. You may see online that we are categorizing at-risk diets as BEG diets. And so BEG stands for boutique, which means instead of funding nutrition research, they are advertising. Exotic, meaning that the ingredient list is containing proteins that we just don't have as much pet nutrition research on. It also could mean less researched ingredients like the pulse legumes. And then the G stands for grain-free, because that does seem to be part of this picture as well. I should note here that there are some WSAVA compliant formulas that are prescription diets that may have exotic ingredients or that may technically be grain-free. However, with those diets, we are not finding animals are having issues, and the difference seems to be the amount of research that those companies are doing before producing those diets. The other very important trend to note is that the companies that produce WSAVA compliant nutrition are not having any cases of nutritionally related DCM. All of the cases thus far over the last number of years are from pets that are fed non-WSAVA compliant nutrition. That's why I covered what WSAVA standards are in part 1 of this series. I'll link that video here. If you haven't watched it, make sure you go back to watch it. This is also why veterinarians are now becoming a lot more insistent that we are feeding pets WSAVA compliant nutrition. And we're trying to protect our patients and prevent them from developing heart disease to the best of our ability. We still haven't figured out exactly what the issue is. When the animals are switched to a WSAVA compliant diet, then you can see improvement and reversal of their heart structure changes. That's a big deal. And it's also wonderful because this is the first time that we've had the ability to reverse DCM. There are a number of brands that are way overrepresented, and so I will list a number of them for you on the screen now. So the current recommendation is that if you have a dog or a cat that has been fed non-WSAVA compliant nutrition, that the very first thing you need to do is contact your veterinarian and get some testing done. So it's likely that taurine levels will still be tested because some patients do require supplementation of it, and also seeing a veterinary cardiologist to have an echocardiogram done is necessary, and using the results of that echocardiogram, a treatment plan can be implemented. After the testing is done, it's important that your pet is blended over to a WSAVA compliant nutrition immediately. We know that that switch does improve prognosis for these patients dramatically. And lastly, I would requests that you submit info to the FDA. It's important that the FDA gets as much information from as many pets as is possible. And we currently have a lot less information on how this is affecting our cats. However, veterinary nutritionists are recommending that all of these things are done for our cats as well. The thing that kind of complicates matters for cats is that they are genetically predisposed to another heart issue called hypertrophic cardiomyopathy, and that type of heart disease can result in very similar symptoms up to and including sudden death. And we know that our cats receive less veterinary care and less referral veterinary care than our dogs do, which is a shame. As I mentioned before, we don't currently fully understand what is causing this DCM in our pets. However, the current theory has found that perhaps there is something with the way these foods are being formulated that's just not getting the heart muscle, the micronutrients it needs to stay healthy. And so even though we don't fully understand the clinical picture, because pets are having a reversal of their heart disease when they're fed a WSAVA compliant diet, that is enough evidence for the majority of veterinarians to recommend making that switch promptly. I liken it a little bit to the unknowns that we have around how grapes affect our dogs. There are some dogs that will have eaten grapes for years because their people didn't know any better and they never have issues. Then there are other dogs that eat one grape and they have severe kidney disease, maybe even kidney failure, and they can die from it. There's this huge spectrum of how grapes affect our dogs, and we don't fully understand why that is. Doesn't matter. I still recommend to all of my clients that they do not feed their dogs grapes. It is not worth the risk. That's the same with this situation and nutrition. I know you want to feed your pet the best thing possible. The best recommendation that I can make to you at this time is to feed a WSAVA compliant diet. It's what I do for my own pets, and it's what I recommend you do for yours. Next video, I will be covering home cooked meals and what should be considered for those situations. I hope you'll join me, and I'll see you then. Bye! I'm Dr. M. Today we are going to cover home cooking as part of our series on pet nutrition. Join me, you'll learn something. It's pretty common for me and for other veterinarians to hear that people are considering cooking a meal for their pets at home. Most often they seem to have the perception that it would be healthier to do this. And so we're going to talk about what the actual research on pet home cooking has shown us and the common pitfalls that we find and what can be done to try to minimize those risks. So there was a large study from UC Davis that evaluated 200 recipes from over 30 different sources. They were looking online, from books, from veterinarians, from websites, all over the place. And what they found is shocking. Only 9 out of the 200, only 9, met the bare minimum AAFCO standards. That's shockingly bad. This means if you are feeding a home-cooked meal using a recipe that you found somewhere, 95% of you are not feeding a diet that is balanced and doesn't have at least one, if not multiple, deficiencies in it. This is a big deal and it's a big problem, and this is one of the major reasons why many veterinarians discourage home cooking. So let's look a little further into, okay, so there were a few that did meet AAFCO standards, but as we've talked about in the first part of this series, the AAFCO standards are embarrassingly low, and essentially those standards tell us that, you know, if you feed this nutrition to a small number of dogs for a few months, they don't die. And that's just not a good enough standard for our pet food today. So the study also looked at how many of the recipes reached the National Research Council's minimum requirements. And there were only 5 of the 200 that met those standards. Now, of those 5, 4 of them were formulated by a board-certified veterinary nutritionist. We've covered what that is also in part 1 of the series. I'll link it here for you now. So what this tells us is that if you are considering home cooking, you must be working with a board-certified veterinary nutritionist. You must. Otherwise, the likelihood of you feeding a complete diet is essentially 0. So in that study, 4 of the 200 recipes were written by board-certified veterinary nutritionists, and all of them met the standards for the minimum nutrition needs. That is reassuring, at least, that if you are working with a veterinary nutritionist, it reduces the risk of you harming your pet. Some of the most common deficiencies were with choline, vitamin D, vitamin E, and zinc. And these are big problems because deficiencies with these can lead to immune system dysfunction, fatty liver, musculoskeletal development problems, and all veterinarians have multiple horrific stories of seeing pets that are on home-cooked meals, and these pets have horrific malformations of their bones, or they even have bone fractures. Because the deficiencies were very commonly involving the same nutrients, even if you try to rotate recipes, it's not going to help your pet, it's not going to fix the problem. There's this perception that feeding pets is simple and easy, but really to do it well is very challenging, and there's been so much research over decades and so much expertise has gone into the WSAVA compliant options that we have that it's impossible to do that well at home. Another problem that this study found was that 92% of the recipes had vague instructions, and so what that means is that if one person reads the recipe and makes that recipe, they will do so differently from another person reading the recipe and making it. Of course, you can understand why this is a major problem. What was also shocking to me was that 85% of these recipes lacked calorie information. How are you supposed to know how much you're supposed to feed your pet if you don't even know the calorie density of what you're making? You can't. A second major problem with home cooking is the lack of consistency of the humans. And we have research on this as well. So there was a study in 2015 that showed after being set up with a proper, fully balanced recipe by a veterinary nutritionist, after 1 year's time, this is not very long at all, only 13% of the people were still making that diet properly. 87% of the people that started out with the proper information they needed were doing it wrong after only 12 months. Even when you give people all the information they need, the vast majority are unable to continue doing that level of nutrition for their pets. Third, there is no bioavailability information about the micronutrients that you're feeding. So we've covered this before in part 1 of this series about WSAVA standards. Just because you give a pet a certain amount of something doesn't mean that their body is able to use it. And so this is a huge pitfall with home-cooked diets because we simply don't know how much of that nutrition the animal's body is able to use. And there's no way around this. What supplies you're purchasing from the grocery store, the bioavailability of those nutrients is going to vary from season to season, from store to store, from brand to brand, and there's no way to test that. This is why if people are insisting on home cooking, they must work with a veterinary nutritionist, and it's also going to be crucial that physical exams, full blood work panels, and urinalysis tests are done on your pet every 4 to 6 months for a healthy pet. This is kind of the best we can do to try to catch issues as they start popping up. So in the research studies on home-cooked pet nutrition, there's also no findings that support there is any benefit to it. And so after all of these things have been said, it's crucial that you avoid home cooking for young animals. This means for most cats and dogs that are younger than a year old, but for large breed and giant breed dogs, that would mean younger than 18 months. This is because during growth, there's very specific calcium to phosphorus ratios that are necessary. Caloric intake changes on a week-to-week basis. There are growth spurts. There's all these other things that we just can't account for with home-cooked meals. The second scenario where you must avoid home cooking is for a pregnant or lactating animal. That's because during these times, energy requirements are really high, and it's not possible to home cook for that demand to keep both mom and offspring healthy. Third, you must not home cook if your pet is overweight. This is because it's impossible to reduce the calorie density enough while still giving them all of the micronutrients they need to support weight loss in a healthy way. The fourth reason is because a lot of pets frankly won't eat a properly balanced home-cooked diet. And this is especially true for our cats. You might have a pet that really likes a little bit of your cooking when you are making meals for the family, and this is a totally different matter. For many people, cooking is associated with love, and they feel like they are loving their pet when they give them a little piece of something that they've cooked. So the only thing to keep in mind if you're going to do that is that all treats and toppers must be less than 10% of your pet's daily caloric intake. The other 90% of their daily caloric needs must come from their WSAVA compliant diet. As long as you stick within those parameters and you're not giving your pet anything that's toxic for them, feel free to offer them small amounts of things that you're cooking at home if it makes you feel good. So if your pet does not fit into the aforementioned definite no's for home cooking, then we still have a few more things to think twice about. One, home cooking is more expensive than buying a WSAVA compliant diet. So if cost is at all a concern, home cooking is not for you. It's also going to be more expensive because of the increased frequency that's necessary for physical exams, blood work panels, and urinalyses. So the cooking itself is more expensive and the increased monitoring is more expensive. Two, home cooking is way more time consuming. Way more. And most pets would benefit far more from additional enrichment with you if you spent that time on a hike or a safari style walk, or if you did a weekly agility class, or if you train your cat to use a harness and leash or build them a catio. Those sorts of enrichments will be far more beneficial to your pet than spending the time home cooking. We also need to think twice if the pet has any medical issues. The reason to think twice is because we don't have any proven therapeutic value for any of the recipes that might be used for these pets. And when we compare that to the WSAVA compliant prescription diets that are therapeutic, they are designed specifically for specific medical issues, and they are proven to help with those issues. Our home cooked diets do not have any of those benefits. Now I'll give you a caveat here. Say you have a pet that has some renal failure, you've been giving them the therapeutic diet, but now they just don't want to eat that anymore. Honestly, they don't really want to eat much of anything anymore. This might be a perfect situation to consider working with a veterinary nutritionist for a home-cooked diet. And the reason is, getting your pet to eat anything at this end stage of life is better than them eating nothing. And we also aren't really worried about the risks of deficiencies and bioavailability because we're only going to be feeding this home-cooked diet for a relatively short period of time. So for these cases, I love working with a veterinary nutritionist to get a home-cooked diet. It can give a little bit more time with a good quality of life for those specific situations. So if you are in a situation where home cooking is what you'd like to pursue, there are a couple things that you must do. And the first is that you absolutely must work with a board-certified veterinary nutritionist and no one else. Only they are qualified to make recipes that are going to be appropriate nutrition for your pet. Now there is a website called Balance It, link it in the description below. It is run by a veterinary nutritionist, and if your pet is healthy, you could consider looking at this website. It is a reputable source of information. However, for pets that have any medical issues, you must work one-on-one with a veterinary nutritionist. I will link a website so that you can find one to consult with who is near you. And then, as mentioned before, you must be doing the appropriate physical exam, blood work, and urinalysis panels to monitor your pet over time to minimize the risks. Thank you so much for joining me. Next time we will be covering raw pet nutrition. We'll see you on the next one. Bye. Hello, welcome to VMC. I'm Dr. M. Today we are going to cover the topic of raw pet foods. Join me, you'll learn something. So I understand that for some people this is a very hot button sort of a topic, and we are going to cover the actual facts surrounding this sort of feeding for our pets. And it's very important that when we are considering all of these things and looking at recommendations from various people, that we remember to look for what experts are saying. The veterinary nutritionists are the experts here. This means that they are the ones that we need to be listening to, and we also need to look at the consensus statements surrounding these sorts of subjects, because when there is a group of actual experts who get together, that is much more likely to be accurate and true compared to a lone dissenting voice or just a couple of dissenting voices of people who are not experts and who often don't have any real pet nutrition training at all. So the first concern that we're going to cover is the fact that these recipes are not complete and balanced nutrition. And we have several studies that look into this. Sometimes they're also actually overdoing certain nutrients, and that's a huge concern because over time, feeding nutrition that is not balanced can cause many issues with immune system, with bone formation, with growth. These diets are dangerous because they are not balanced. Another fairly common issue is that we often see patients with hyperthyroidism, and so what ends up happening is that from the meat that these animals are being given, they are ingesting thyroid, and that is resulting in their bodies having an elevated thyroid level, which is dangerous for them. And in the studies done on this concern, all of the animals returned to normal thyroid function once their diets were switched to something appropriate. Next, we have to consider the safety risks around these sorts of diets. And I do not say this lightly. Feeding a raw diet is a public health safety risk. It is also a safety risk to the individual animal. And part of the oath that veterinarians take when we start practicing is that we will use our knowledge not only to protect and help animals, but also to protect the human species that interacts with the animals that we're treating on a regular basis. We have so many studies on this. These diets are regularly contaminated with salmonella, with E. coli, with toxoplasmosis, with Clostridium, with Campylobacter, with Listeria, and on and on and on it goes. The contamination risks are extremely high. Some proponents of feeding this way lie and say, well, that's okay because cats and dogs are immune to these infections, which is simply not true. Every year I lose patients to these infections from their diets. And what's horrifying is that these people, well, they're risking their pets' lives for no reason, but they're also risking the lives of every single person who comes into contact with their pet. And that is a big problem. All of them are at an increased risk of contracting one of these contaminants from their pet. The fact is that these issues can and do kill people every year. And so feeding a diet that risks this is just not acceptable. There are also risks to pregnant people, especially with toxo. People that are pregnant and that come into contact with a cat who is carrying toxo can see significant issues with the fetus that they're carrying. And in adults that are in contact with toxo, they can die from it because of severe encephalitis. We have studies that feeding raw meat to cats increases the toxoplasmosis seroprevalence in those cats, and therefore that increases the risks to the people around them. Some people will go, but wolves eat this, and what they don't appear to realize is that we have selectively bred dogs over thousands of years, and that dogs are not wolves. We have researched that their GI tracts are different, that they have different digestive enzymes than wolves do. We also now expect our dogs to live decades, whereas a wolf in the wild maybe lives a handful of years. And part of this is because we now have much better nutrition that is suited for how our dogs have evolved alongside the humans that they keep company. I also frequently hear the excuse, especially for cats, that they're carnivores, so they need to eat this sort of a diet. So let's back up a step here, because dogs, in fact, are omnivores. They do not require meat at all in order to maintain a healthy life. So a dog can be fed a vegetarian diet and do well with that because they do not need any amino acids from their diet. When we move on to consider cats, they are what we consider an obligate carnivore. What it means is that they require some meat because they require nutrients from that meat and their body is unable to make it on its own. The most common amino acid that people have heard of in regard to cats is taurine, but they also need arachidonic acid and arginine and retinol, and the only way that they can get them is from eating the flesh of other animals. This doesn't mean their diet must only be animal flesh. It means that a certain amount of their diet must be meat-based. So you cannot feed a cat a vegetarian diet, and that is why the WSAVA compliant diets for dogs have a different nutrient makeup than they do for cats, because there has been a lot of research in this area and the veterinary nutritionists know about these feline requirements, and the formulas are being tested to prove the bioavailability of the micronutrients, and the nutrition is formulated for optimal use from a feline body compared to like a canine body. So as a summary, just because an animal is considered a carnivore does not mean that they can't eat carbs or grasses or vegetables. It just means that that cannot make up their entire diet. They require animal flesh and they are able to digest carbohydrates. Some people claim that cooking pet nutrition is abhorrent because it destroys the digestive enzymes. This frustrates me so much. All the enzymes that our pets need to digest food is in their GI tract. That's what the GI tract does. That's its job. You don't need digestive enzymes from your food, and if somebody is telling you that you do, they clearly do not grasp basic biology. I do want to mention that feeding bones, whether cooked bones or raw bones, is not ever advised. These bones frequently cause tooth fractures, which is very painful. They also often damage the GI tract. Shards can puncture the GI tract, which often results in the death of the animal, and bones very, 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 very often cause obstructions that require surgery. And so for our cats and dogs, do not give them bones. This is a dangerous thing to do, and it is not in their best interest. If a dog enjoys licking out like the middle of a bone, a much more appropriate and safer alternative would be to get a Kong or a Topple, stuff it with canned food, or you can even add some kibble in there and throw that in the freezer and then give that to your dog to lick out. That will be a much safer and healthier option for them. Proponents of raw food diets claim that they are safe and natural, but in reality they are ignoring a large body of research that proves the exact opposite. There's not a single research study that has concluded that feeding a raw diet is more beneficial to the animal in any way. And so the best recommendation is to feed a WSAVA compliant diet. I have gone over what those standards are. I'll link that video here and put it in the description below. It also needs to be noted that freezing and freeze drying items is not an appropriate way to try to preserve them. Those methodologies are actually often used when we want to preserve things like salmonella and E. coli and other infections, and so you should not be feeding freeze-dried or frozen items to your pets either. This includes pig ears, bully sticks, those freeze-dried treats that you can find. Do not feed them. The risk of contamination is incredibly high. If you are wanting to try to slow down dental disease, I've done a video on that as well, and I go over the things that you can give to your pets to slow down dental disease, and I'll link that video in the description box below. The last thing that I'm going to cover are the consensus statements from a host of organizations about feeding a raw diet. AHA, the AVMA, the Canadian Veterinary Medical Association, the FDA, and the American College of Veterinary Nutritionists all have position statements saying that feeding a raw food diet is not appropriate, it is dangerous to the pet, it is dangerous to the public, and we cannot be doing this for our pets. These are strongly worded consensus statements because the evidence is so very conclusive. There is zero benefit and there are tons of incredibly well documented risks. So it is for this reason that I urge you to check out my previous videos on what the WSAVA standards are and to find a nutrition that meets those standards. Alternatively, you can look at my home cooking pet food video. There are a number of very serious pitfalls that you need to avoid if you're going to consider that, but it links to a couple of reputable sources as well as to how you can find a veterinary nutritionist to help you if that's something you're very serious about pursuing. There is absolutely no reason not to be cooking the food that our pets eat. It is much safer for them, it is much safer for us. If I can get you to be cooking what you're feeding your pet and feeding a balanced nutrition, then I'm going to be happy. Thank you so much for joining me on today's video. I hope that you've learned something today, and I hope you will join me on the next one. All right, we'll see you then. Bye. Hello, I'm Dr. M. Welcome to VMC. Today we are going to cover a little bit about cat nutrition specifically because there are so many myths and misconceptions that get spread around, and so let's go delve into what research actually tells us. Join me, you'll learn something. The first misconception to cover is the fact that people get confused about what an obligate carnivore is and what that means for the nutrition that our cats need. People seem to think that an obligate carnivore means that cats must only eat meat and they can't digest or eat anything else. And this isn't true. We have research indicating that cats are able to digest carbs and that it's perfectly okay for them to get energy from those sources. The thing is though, because they are obligate carnivores, what that means is that at least some of their diet must be animal flesh, so they cannot be fed as vegetarian. Trying to feed a cat as a vegetarian would be considered animal cruelty, and you can't do that. Their body needs the taurine, arachidonic acid, and a few other things from the meat that they ingest, as their body's unable to produce those things on its own. Omnivores and herbivores are able to produce those sorts of things on their own, therefore they don't need to eat meat, but the cat cannot do that, so they need at least some meat, but that doesn't mean they can't digest carb sources as well. Second, I hear all the time that feeding kibble is bad for cats. And when you ask people why, sometimes they say, oh, cats that eat kibble are fat or they develop diabetes. So when looking into the research studies about obesity and its relationship to diabetes in cats, there is nothing showing that kibble in the cat's diet is a risk factor for these issues. Now, what the studies have told us is that feeding a WSAVA compliant diet does matter. We need to have those research studies proving the bioavailability of the micronutrients to make sure that the cats are getting what they need from their diet. What did matter was the amount of food that was fed, the number of meals that was fed, the micronutrient makeup of the food, and the caloric density of the food. If you are feeding diets that are less calorically dense, then the cat can have more volume to feel more full but not eat as many calories. And so if you feed more frequent meals through the day, the better that seems to be for them, for their digestive tract, for their health. This is one of the reasons in my cat enrichment video we do discuss food puzzles so much, because that is a great way for cats to be able to have access to kibble all throughout the day so that they can graze and have, 6, 8, or however many small meals they are wanting in each day, and they can go and hunt the food puzzle down, get their food, have that behavioral fulfillment as long as it's not a frustrating puzzle for them, have their small meal, and then move on to their next nap, as cats are tending to do. And so feeding kibble on its own is not a negative thing for our cats. We just need to be aware of all of the factors that play into this and choose the nutrition they are eating carefully. Cats are individuals, and they might do better with only kibble if you have a cat that doesn't like canned food, say, or there are going to be some cats that are going to do a bit better with only canned food. The trouble with feeding only canned is because it's better to feed so very many meals for cats in a day, that can really be a struggle for people who are working or out of the house for a large portion of the day, and then the canned food just doesn't stay fresh and you can't really feed, the many small meals like you can with kibble in food puzzles. But it should be noted that, of course, canned food does have a higher moisture content than kibble does, and that additional water in the canned food for some cats can really help them to feel more satiated, and that can help with weight loss if they are feeling full from water, which has no calories, compared to needing more kibble, which will be more calorie dense. I already have a video on healthy feline weight loss. I'll link it here, and it will also be in the video description below. It's also important to note that the research shows us that kibble does not cause diabetes. However, it should be noted that once a cat has been diagnosed as diabetic, switching to a diet that is lower in carbohydrates may improve their chances of going into remission from that diabetes. So the carbs don't cause the diabetes, but eating a lower carb diet may help to manage diabetes for our cats. Now, the thing that the studies did show was that diets that are lower in carbs often tend to be higher in fats, and for some cats that can cause weight gain. And so we have to be careful that if we do have a diabetic cat that we are trying to get to eat a lower carb diet, that we do watch their body weight and their body condition score, as we don't want that increase in fat to cause weight gain. Another thing that I will hear from people when discussing kibble and cats is that kibble is bad because then the cats aren't getting enough water, and therefore they are at more risk for developing bladder issues like feline idiopathic cystitis and or chronic kidney problems. And again, the research just doesn't show this. There were some studies that were done that had cats eating canned foods versus eating kibble, and their urine concentration was not significantly different. So if cats get more water from their food, it seems most likely that then they just drink less water, and so their urine stays as concentrated as if they eat kibble, and then they drink a bit more water along with that kibble and end up with the same sort of urine concentration at the end of the day. What does really matter is that we provide our cats with enough appropriate water resources. And so they do need a few of these spread throughout the house. They must be glass or ceramic or stainless steel. And some cats do also have a preference for a wider, more shallow bowl so that they can have their back to the wall and still kind of watch the environment as they drink to help them feel safe. And some cats also don't seem to enjoy the feeling of their vibrissae, their whiskers, touching the edges of containers. So having a wide and shallow bowl can be helpful for these cats. And then at least one of the water sources needs to be a running water source. And so this means a fountain of some sort. We do have some research showing that cats do tend to drink more if they have access to flowing water. All water sources must be cleaned out and replaced at least once every single day. What we do know from the research is that the mineral content of the diet and the protein level in the diet did influence thirst. So those things do matter. And so that's why, especially for the prescription diets that are designed for cats that have bladder issues, they will have different mineral content in them in order to encourage drinking and more frequent urination in order to void the bladder more often, which seems to be helpful in reducing things like bladder pain for cats that have cystitis. Kibble on its own is not likely to slow down dental disease, but there are some formulas that are designed to slow down dental disease, and so feeding those to healthy cats as the kibble portion of their daily calories can be quite helpful. I have done a video on dental disease prevention and slowing down the formation of dental disease. I'll link it in the doobly-doo below. So at this point, the big takeaway is that for cats as a population, feeding canned is not inherently better than feeding kibble, and kibble is not inherently better than feeding canned. It's going to depend on the individual cat. So when you have a cat join your household, I strongly encourage you to present them with both canned food and kibble. This is because our cats do tend to form pretty strong texture preferences as they get older. And so if we have cats that are used to a variety of different textures, that can be very helpful so that as they age, as they develop more medical issues, then we have more options as far as prescription nutrition to treat those medical diseases as they occur. So for my personal cat, what I do is I offer a small canned meal in the morning and in the evening, and I use that canned food to help work on kennel training with my cat and help him to develop positive associations with spending time in his kennel and having it be a good thing. And then every morning and every evening, I load up his food puzzles and I place those in various areas around the house so that through the day and overnight, he can have as many small meals of his kibble as he wishes, until they're empty, of course. And so that way you can be measuring their food intake by measuring the volume of canned food that you're feeding and the volume of kibble that you're loading into the food puzzles, but it still allows them to graze throughout the day as seems to be best for their GI tract. All this being said, if you already have a cat that absolutely hates kibble or absolutely hates canned, I hear you. Cats and their texture preferences can be incredibly frustrating, so just do the best you can with what you've got. Offer as many meals throughout the day and throughout the night as you can, so long as it is a WSAVA compliant formula and it's suitable for what your individual cat's needs are. That's fantastic. Now do keep in mind that if medical issues arise in the future, your veterinarian may recommend prescription diets to help manage those diseases. I post a new video most Fridays, so I hope you'll join me next week, and thank you for watching this video. You take care, and bye!